Thank you. And then last, certainly not least, Ms. Joell, is that how you pronounce it?
Yes. Mm-hmm.
From Community Advocates for Family and Youth Victim Services.
Right. Thank you so much for allowing me to share with you what we've done with our funds. Our grant specifically dealt with counseling, dealing with domestic violence through mental health services. And what we were able to do was to expand the opportunity for domestic violence victims to receive services at no charge to them. A lot of our clients that get referred to us are below the poverty level, and counseling sometimes is out of reach. So we were able to open the door that way. So we used it in two ways. One was we expanded one of our part-time mental health clinicians to full-time. The other was that we used also part of the funds to pay a PhD level supervisor so that we could bring on a bilingual counseling intern. And that helped because 23% of the clients that get referred to us are Hispanic, and 9% of them look for therapeutic services. So we were able to offer that. We do a lot of modalities, but the one modality that we focused on for the domestic violence community was trauma-focused cognitive behavior therapy. And the reason why we did that was because that's a proven evidence-based model that shows you that you can have a positive impact in the 24 weeks. And a lot of times that's about the length of time that you can keep somebody engaged in it. So I'm happy to say when you look at the numbers, 20 of the people that have come through the program using the council dollars actually either completed 6 or more sessions and achieved 5 of their treatment plan goals. And even though in the numbers, I also shared with you the no-shows and cancellations, but that just reflects people that may have come 2 or 3 times, but the fact that they came, they received some psycho-educational information to help them move forward. The other good thing why we were glad to offer TFCBT is because that model allows you to work with the children who are impacted by domestic violence. And so you not only can deal with their trauma, but then you can incorporate the parents' ability to improve their parenting skills as well as the methods they use to support. There's a lot of other wraparound services that that goes with that, because in situations where there are repeat domestic violence calls and children in the home, we actually do a home visit. And we go there with our case manager, with our therapist, as well as law enforcement. And it's really designed to talk to the parents about how mental health can be a positive influence in their situation, particularly their children. And oftentimes parents say, well, we don't do anything in front of the children, but what we talk about is if they're in earshot or in the room, or even if you're carrying them, it's having an impact. And so we've seen a lot of success that way as well. And those were the specific dollars that we used in those 2 areas. And we received $26,000, and we're on track to, use all the funds. I do have one outcome story to share because, well, 2 really, because the other thing we were able to do was open it up to have a male support group, because we had seen increase in male victimization, and it really had to do with how the Prince George's Police Department changed their approach to dealing with domestic violence. And so we had to come up with a way to respond to that as well. So we do have a Saturday male support group. Granted, first, one of the men commented that they were, really embarrassed to come and share. But after being a domestic violence survivor, right now he's been able to, improve his parenting skills, also to meet up with other men that are going through the same thing. And so they have that kind of collaboration and support. Another example was a woman that, not from our country, but she reported the domestic violence. She went to the shelter, had never worked before, and then while she was on her journey, her children were taken away from her. And from her perspective, she thought, I did the right thing. But she came to counseling, and she couldn't have her children because she didn't really have any place to go. She didn't have a support structure here. But she's come to counseling. She's developed a living plan where she's been involved in the court process. And she's had victim services. She's able to now move from a room that we were able to help her find to, like a 1-bedroom apartment. And so she is on her journey towards getting her children back. And so those are how we use the funds.
Thank you so much. Could you just briefly explain the connection between both, or the involvement of both Prince George's County Police and Laurel City Police in your organization? What is that nexus?
Okay, well, we act as the primary victim service provider for Prince George's and the city of Laurel. And so what that means to the community is that we can be proactive in that if there's a domestic violence situation, we have a helpline too, but if there's a domestic violence situation, the detective on the scene or the investigator on the scene, they can call that helpline and get us involved immediately. And whether that is, providing temporary, overnight stay at a hotel or just making sure that someone connects up with that person the very next day, they're able to do that. And we do that exact same service for the city of Laurel.
Okay, and you were doing that prior to this grant, or that's
Yes.
what you're doing with the grant?
No, we've been in partnership with the Prince George's Police since 2005, the city of Laurel since 2010.
Great. Okay. Thank you. Questions from council members? Councilwoman Harrison.